Why do I lose my libido? But why do I lose my libido? I do not feel like a real man anymore. Loss of libido is defined as lack of interest in sexual activity for no apparent reason. If before, it was thought that the decline in libido affects only women, at this time, we find that this sexual disorder is becoming more common in men. It is manifested in particular by the decrease or absence of fantasy and desire. Men start by not looking for stimuli, wanting any form of sexual activity, then reluctantly giving into their partner's advances. According to current figures, 5 to 28 of sexually active men, all ages combined, encounter a drop in libido compared to 3 of proven cases. The problem can be occasional, periodic or frequent. However, a loss of sexual desire directly affects the quality of life of an individual as well as that of his/her couple. Causes of male libido decline. Many factors can cause the decrease and loss of male libido. Several studies show that libido disorder occurs as age progresses. According to a U.S. study, 6 of men between 40 to 50 years old have this problem compared to 26 of men over 70 years old. The sexual disorder can also have psychological, emotional, or even health problems. To regain your libido, it is important to understand the origins. Here are some factors that can answer the question why I lose my libido. Hormonal disorders. Several hormones come into play to ensure sexual function in men, such as testosterone, dopamine and serotonin. Hormonal disorders caused by stress, the environment and many other factors can therefore alter the male libido. It can also occur at any age. The drop in testosterone. Testosterone is one of the androgen hormones, the main hormones of male sexual function. A decrease in the secretion of this hormone naturally has a direct impact on sexual desire. On average, a man must have a testosterone level between 10 to 12 nanomoles per liter of blood. But if this rate drops to 6-7 ml or less, the individual is prone to low libido. In this case, a medical examination is required. You can consider hormone therapy or naturally increase your testosterone through physical exercises. The lack of dopamine. Dopamine also plays an important role in the sexual drive for both men and women. This hormone is actually a neurotransmitter that stimulates sexual behavior. Its main role is therefore to awaken the desire and the sexual drive. The more the body releases dopamine, the better the libido. A lack of dopamine can also lead to lack of interest in sex or other sexual activity. This can be corrected with proper nutrition. The decline of serotonin. Serotonin is a neurotransmitter that has several roles in the body, including that of boosting sexual desire. A reduced rate of serotonin decreases the male sex drive and causes depression. This is why some antidepressants affect sexual desire in men. In all cases, it is essential to rebalance the hormone levels to find a satisfactory libido. I lose my libido because of bad habits. If you're wondering why I'm losing my libido, your everyday habits may be answering this question. Starting with your diet, your sleep, the way you take care of your body. A poor diet. Junk food is one of the leading causes of low libido and many sexual disorders around the world. Foods that are too high in fat and sugar are known to limit testosterone production. Excess fat in the abdomen also decreases sexual ability. The lack of physical activity. If you do not do enough exercise, there is a good chance that you will not feel any libido anymore. This notably impairs blood circulation and oxygen transport, which is essential for a better sexual capacity. Sports activities such as aerobics are among the best for blood circulation. And irregular sleep. Lack of sleep is also known to decrease sexual desire. The body needs rest to relax. As the person is exhausted, she naturally has a low libido. Fatigue has the same effect. It is therefore necessary to allow all the necessary rest so that the body regains its vitality and its sexual capacity. Other factors involved. The decline of the libido can also have other origins of which we are not often aware. The sexual capacity is indeed affected by certain substances produced within the body itself or introduced from the outside. These include hormones, vitamins and medications. The stress. Stress is known to increase the production of cortisol, also known as stress hormone. However, this is always accompanied by a reduction in testosterone levels in the body. Better stress management could only be beneficial for you and your libido. Relaxation techniques and some supplements will help you restore balance. The practice of regular physical exercises is also recommended. The lack of sun. The sun is the main source of vitamin D for all of us. This vitamin promotes and increases up to 69% the production of testosterone in men. The lack of sun translated by the lack of vitamin D thus harms your sexual capacity. To avoid a low level of vitamin D, it is recommended to expose oneself to the sun, but always by protecting one's skin. You can also consider taking vitamin supplements. Drug treatments. Certainly men and their sexual appetites also react to certain medications. Groups of antidepressants, antihypertensives, antipsychotics, anticonvulsants. Include, for example, several drugs known for their harmful effects on libido. If you suspect that your treatment is the cause of the loss of libido, it is safer to consult your doctor.